Standing on the shoulders of leaders. Hard act to follow here. Awesome work that's been done by the past presidents, the leaders, the boards, the executive directors of ISNA. And as I thought about this work in relation to the Code of Ethics, I thought a lot about the lateral violence work that I've done through my doctorate, that Blaine and I have tag teamed throughout the state about professional behaviors of nursing, emotional intelligence, political activism. I've spoken to most of the major health systems throughout the state. Was invited by the National Federation of Nurses, which is the ANA lobby or labor group, collective bargaining at their labor academy. The National Association of Student Nurses, ANA, invited me to speak there in San Diego, and darn, I had to go. Talking at Sigma Theta Tau about the Institute of Medicine report, also about incivility with member Susan McRoberts and Pam Hunt last year, with the Indiana Association of Student Nurses about the value of ISNA and leadership. I'm getting ready to meet with the IU School of Nursing Student Nurse Board to talk about ISNA, so excited about that. I met with a newly formed group, the Central Indiana Organization of Clinical Nurse Specialists, to discuss potential collaborations throughout the state to enhance their voice, because they want to make sure that they get involved with the advanced practice work that's coming up. Involved with the Center of Nursing with Kim, strategic planning, the Development Committee strategic planning. I continue to coach people, whoever needs help in whatever their role they're in as a nurse or as a student. I experienced what I didn't realize, that we were not going to allow Ernie to retire, or else I would have said no when he told me. His transition to OB, ocean bliss. And thank you for your service and your support. Welcome Gingy Harshi-Mead and Blaine Miley and Marla Holbrook into an enhanced role, and also with Chuck Lindquist and our fabulous ISNAP staff. I've kind of branched out and tried to make sure that I'm involved at other levels, other boards that can help with the increased visibility of ISNA, but also to kind of see what else I need to be involved with. I'm currently a vice president of the Centerstone of Indiana board, and that's an outpatient mental health organization. That's been a phenomenal experience. We had a board meeting last night in Louisville, and I introduced myself. As people talked, I was one of the last, and I said, I'm the nurse. And I don't know how many people came up to me afterwards and said, we are so glad that we have a nurse on this board. So just remembering that you're always a nurse. It doesn't matter if you're faculty, if you're a student, if you're at McDonald's, you're still the nurse, right? As one of the presidents mentioned earlier, we've all been involved with strategic planning. We had Terry Gaffney in 2012 with us from ANA to help facilitate that, and that was an awesome experience. Our work through ISNAP, folks, helps us with our Provision 3. Blaine continues to receive calls for advice about handling difficult situations. He hands that off to board members if there are things that are outside his scope. I continue to get calls about the Board of Nursing and how to navigate that, and I try to assist folks with that. Blaine keeps us apprised of all potential legislation that we need to be involved with. We talk about who are the stakeholders, who's best to support him in that. We've worked on the ISNAP RFP for the contract for next year, still waiting to hear from the Board of Nursing about that. But they love our program, and we've done a wonderful job with that. As I think about Provision 4, I thought about the ISNA's first call to action as I reviewed the 110 years of nursing in Indiana. And we were called by the governor to come into being to help support healthcare in Indiana there. One of the things I think the students, it's important for you to recognize is that the nursing work hours were decreased to 12-hour work days instead of the usual 20. So I know that makes you happy as you think about graduation and the importance of advocacy of ISNA. As we talked about the Institute of Medicine report last year, I had the privilege of speaking with Dr. Judy Halstead, who's the president of NLN, also an ISNA member, and Susan McRoberts, as they talked about education, practice, and we talked about service. Diana Sullivan and I attended the ANA's Leadership Institute in 2012. Gingy and I and Ernie and I have gone to chief staff executives and chief elective officers symposiums through the American Society of Association Executives. That was a mouthful there. Continue to speak out. Continue to talk to anybody that'll listen to me about lateral violence. We've continued to connect with the students, Blaine and I, as well throughout the state, so that we're making sure that we have a voice and that the students understand the importance of ISNA, the advocacy work, and also have done a lot of integration into curriculum with lateral violence, with political activism. Blaine and I had an awesome experience this summer as we worked with the DNP PhD students in health policy. I got to teach some health policy classes for University of Southern Indiana and for IU School of Nursing that I probably wouldn't have been asked to teach in because of this role. Currently serving on the ANA Care Coordination Professional Advisory Committee Quality Measures Panel. And I'm still involved with the National Association of Clinical Nurse Specialists on the Education Council, or Education Committee for that, because I feel like we need to be as diversified as we can as leaders. Got to experience the last House of Delegates with ANA and the first membership assembly. Those were awesome experiences with a lot of the board members, with Ernie, with Gingy. Provision 8, we've had a lot of collaboration, and especially where's Miss Mary back there with our statewide trauma work that she's doing an awesome job with. And we're bringing a resolution with, that Tara Kunkel brought forward on military assessment. The work through the members and through the board continued to exemplify the Code of Ethics. Our work with the Center for Nursing, with the Action Coalition, Kim will be glad I got that correct this time. Barb's work with the APRN white paper, awesome group that's worked on that throughout the state and ready to move forward with further discussion. Through my president's messages, I've continued to challenge us all to speak out about lateral violence, about leadership, about how we have been involved with the Race for Relevance, to Skinny Down. We moved our pillars to professionalism, leadership, unity, and advocacy. Talked a lot about responsible nursing practice, sustaining change. Blaine initiated, where is he? Facebook, Twitter, the ISNA enabler, the political action committees that are doing awesome work. And Blaine continues to say, and I had to keep having to write these down, the legislators listened to conversation about brain drain, patient access to care, and patient safety. So as you talk to your legislators, think about brain drain, patient access to care, and patient safety. Blaine's developed a CNE on affordable care. Have presentation, will travel for gas money. Gingy and the ISNA staff have initiated a career center in 2013. Property manager Marla has done an awesome job. Our building is rented. We've changed our marketing strategy, have a new member flyer, recruiting flyer, a pronged approach to connecting with members, and we're connecting with the organization as well as with the board president. Gingy and Blaine have made changes, and Marla, to the ISNA bulletin, so send your comments to them as well. From the ANA perspective, there's a call for professional nursing issues panel on the nursing administration scope and standards revision, as well as the code of ethics revision. And the code is going to call for clarification of provision 8 and 9, linking to the social policy statement and scope and standards, and strengthen that code in relation to leadership, advocacy, and collaboration for social justice and social determinants of health as we talk about health policy education. Also about moral distress, incivility in the workplace, and the code to support the moral courage and the moral resilience, addressing threats to patient care and nursing integrity. And I think what you heard this morning has been awesome work that would not be possible without nurses in Indiana, whether they're future members, current members, past members, board members. Thank you all for all of your work.